Hi, I'm Melanie Boetel, and I'm an Assistant Director at the Division of Behavioral Health, which is one of the divisions within the Department of Social Services. And we're honored to be able to present at your conference today, and we hope you'll find this information useful. I'm here with two of my team members to share with you about the mental health and substance use disorder treatment resources available in South Dakota. We wanted to be here today because you probably see people on some of their worst days, and some of those reasons may be related to behavioral health concerns. So we wanted to share with you about resources available for those individuals or their loved ones that you have contact with, so that you may be able to help them know how to access resources. So a couple of my team members that are here today. First is Andrea Heronimus. She is our Mental Health Services Program Manager, and she will share information with you about the Community Mental Health Center system, as well as a program we have underway currently regarding resources and ways to cope with the COVID disaster that we're all experiencing. And then Stacy Krall is our Substance Use Disorder Treatment Services Program Manager, and she will share with you about the array of substance use disorder treatment services available, trends that we see, and resources specific to opioids. Next slide. So first, let me tell you a little bit more about the Division of Behavioral Health. Our division provides oversight of the publicly funded behavioral health system. Funding includes mental health federal block grant, a substance abuse and prevention federal block grant, other federal grant funds, and state general funds. And individuals without a payer source, such as insurance or an employee assistance program, or their own ability to private pay for treatment themselves, who meet indigent funding guidelines, are able to access these funds for their treatment costs. The agencies that we'll be telling you about will be able to help individuals determine if they meet the funding guidelines. And we also have hardship consideration options for those who don't meet the income eligibility, but still have financial barriers to paying for their necessary treatment. And you can see on the slide that the people that we serve are children and adults with serious mental illness, individuals with substance use disorder needs, as well as individuals that are in need of prevention services to try to avoid something developing into a substance use disorder. Next slide. So what does the publicly funded behavioral health system do? We provide an array of outpatient mental health treatment services, outpatient and inpatient, and a variety of residential substance use disorder treatment services, and prevention services. We also have some more specialized types of populations that we serve, including those that are involved with the justice system. We have substance use disorder treatment services for pregnant women and women with dependent children in Rapid City and in Sioux Falls, and Stacy will tell you a little bit more about that, but those are programs that women are able to come with their young children while they are in treatment. And we have intensive methamphetamine treatment services. All of the substance use disorder treatment providers are able to address meth as well as any of the other substances, but sometimes for those that have a really significant impact due to meth use, some intensive programming is a better option to address all of their treatment needs. And Stacy and Andrea will share a little bit more about all of the treatment agencies that we have available in South Dakota, but just to kind of put that in perspective for you, in our last state fiscal year, which ran June 1st, 2019 to May 31st, 2020, that was our state fiscal year 20, we accredited 52 total agencies, and that included 11 community mental health centers, 42 substance use disorder treatment providers, and 22 prevention agencies. Now, if you do the math, that will add up to over 52 agencies, and that's because many are able to provide a combination of those. So they may be a substance use disorder treatment provider as well as a prevention provider, and they may also be at a community mental health center. So next, I want to turn this over to Andrea Heronimus to share a little bit more about the Community Mental Health Center system.
Okay, so this next slide is showing you a picture of the publicly funded mental health services that we have here in South Dakota. We have 11 community mental health centers that provide the outpatient services to children, youth, adults, and elderly residents with acute mental health disorders or serious mental illnesses. In order to ensure that these services are available to all South Dakota residents, the Division of Behavioral Health designates counties to each community mental health center, which functions as that mental health center's service area, which is also known as the catchment area. The 11 CMHCs and their main office locations are listed on our website, and I believe Stacy will be showing you more about our website and how to locate the services that you may be looking for just a little bit later in this presentation. The community mental health centers are required to provide emergency services, assessments, outpatient services, as well as specialized outpatient services for adults with serious mental illness. They also provide specialized outpatient services for youth with serious emotional disturbance and their families across the designated catchment areas. And it's good to note that over 20,000 people between children and adults receive services at a community mental health center over the last year. And over 17,000 of those individuals did receive publicly funded services. I'll turn it over to you, Stacy.
Great, thank you. This here map represents the publicly funded substance use disorder treatment services across South Dakota. And so as Melanie started talking a little bit about the treatment providers and the levels of care that are provided, this map kind of shows a breakdown of what those services are. First, I want to start with the black dots. The black circles represent a community that has a substance use treatment provider in that community. As Melanie said, we had 52 agencies that were accredited in fiscal year 20. Of those 52, 34 of them were substance use disorder treatment providers that had contracts with the Division of Behavioral Health. 16 of them provided justice services to justice-involved adults, and 10 of them provided services to justice-involved youth. To go a little bit deeper, as I said, the black dot represents a community that has a substance use treatment provider in that community. However, you can see in areas such as Sioux Falls or Rapid City, there's only one black dot, but there's multiple providers in those communities and several other communities as well. The symbols on the left-hand side represent the level of care. As you can see, there's lots of blue triangles. Those represent outpatient treatment providers. You can see that there are a few communities that don't have any providers there, but through the use of telehealth, services can still be provided. We'll talk more about telehealth in just a few minutes as well. I wanted to call out some of our higher levels of care, some of our more specialized treatment services. The purple symbol represents our adult inpatient providers. We have several of them on the map. You can see we have a provider out in Sturgis that is with Compass Point. We have a inpatient unit in Rapid City for our pregnant and parenting program with BMS Full Circle. Rosebud Sioux Tribe has an adult inpatient program. If we look to the east a little bit more, we have two providers in Yankton that provide inpatient treatment. Those providers are the Human Services Center and the Lewis and Clark Behavioral Health Services. And then in Mitchell, we have Stepping Stones with Dakota Counseling Institute. And there is the provider in Canton, Keystone Treatment Center. And then we have the newest provider, which is accredited through the Division of Behavioral Health, is the Avera Health System. And then way up north, we have Sisseton has Dakota Pride Treatment Center. This map is actually a representation of our providers from fiscal year 20. We are working on getting that updated here for our presentations, as we have recently awarded a new provider through a request for proposal process up in the Aberdeen area. We'll be expanding inpatient treatment services later this year. So we're very excited to bring them on board as we need additional providers up in that area to continue to be able to serve that population. We also do have the intensive methamphetamine treatment services. As Melanie indicated, all of our providers are able to serve individuals who have a methamphetamine use disorder. However, due to the severity of some individuals, they do need a more intensive long-term program that offers additional structure and support. And so you can see through the kind of that teal oval, we have providers in Rapid City, Rosebud, Mitchell, and Sioux Falls. Again, we're excited to be able to offer that opportunity and that expansion to start happening up in the Aberdeen area as well. We have 4 providers that offer inpatient adolescent services in Rapid City, Huron, Sioux Falls, and Canton as well. And so just looking a little bit through this, over 12,000 clients were served through substance use services in fiscal year 20. And I'm going to slide over here to actually show a copy of how our website, so then you're able to see how to access services, because we do have a fairly user-friendly website, and it's great to be able to know, okay, I have a family I'm working with, I have an individual I've come into contact with, who can I get them connected to in their community? And as Melanie and Andrea are speaking a little bit later, I'll actually be typing these links into the chat box, so you'll be able to copy and paste them down for your reference as well. But under the dss.sd.gov, under behavioral health, there is, it brings us to our web page, but under the substance use disorder services, there is it says to identify a treatment provider in your area, click here. So I'm just going to click on that. And this brings us to a map that's broken up actually by our SAMHSA regions. So the colors are a little bit different than the colors that were represented on the community mental health map that Andrea had shown just a few minutes ago. So I'm just going to click here in the Minnehaha area, since that's where I'm located. If I click on that county, it's going to auto-populate a list of substance use treatment providers, as well as the community mental health center that oversees that area. And each of these providers are located in Sioux Falls, or in the, just right in that Minnehaha County area. And then it can actually bring you to a link to their website, and it will also give you their phone number for contact information as well. As we indicated, 34 of the substance use treatment providers have a contract with the Division of Behavioral Health, and that is represented by funding assistance available. So if you have an individual who doesn't have another funding source that would be eligible for funding assistance, that's a great way to say, okay, well, I can make this referral to this agency, knowing that they have a contract and maybe have some flexibility with their services. Just going to go back here, because then again, if I go back to like Hughes County, it's going to bring me to that provider in Pierre. And so again, those mental health and substance use treatment providers. So it's a pretty user-friendly map in order to know who are those providers. I take quite a few calls from individuals looking for services, or their family members looking for services. And it's a go-to for me as well, just knowing, sometimes my counties, I'm not great on recalling who, where that's located and who that provider is. Another really great resource on our website is a list of treatment agencies and services. Just going to pull this up. It's an alphabetical list, and sometimes people are looking for something more a little bit detailed. So that is another really good list that's a good resource for folks as well. In terms of accessing substance use treatment services, there's some information on the website as well. And so I just want to call that out, and being able to utilize the website to be able to gather that information and resources. I'm going to come back over to the PowerPoint here, if I can. There we go. Okay, so just to tell you a little bit more about our trends of what we're seeing, this map shows clients served by diagnoses. So looking at the last 5 fiscal years, this is all clients served, so adolescents through adults. Alcohol continues to be the leading use substance for which individuals are seeking services. So that's their primary diagnoses. We do see that drop over the last several years, down to 45% in fiscal year 20. And with that, that means that other substances are often going up. And so as you can see, in terms of 27% was methamphetamine use for fiscal year 20. We do see that increase since fiscal year 26. And with that increase, we see a reduction in marijuana use for all clients served down to 13%. And so if you have seen more individuals that are using methamphetamine, you hear about it more in the news than just 5 years ago, this data continues to support that more individuals are seeking services for methamphetamine now than they were 5 years ago, but alcohol continues to be that primary substance used. Now, if we were to slice this a little bit differently and look at just adolescents, those trends would look very different. Cannabis is the leading use substance for adolescents, followed by alcohol. And if we'd looked at just adults, that primary, those diagnoses trends in terms of alcohol followed by meth and then marijuana would be consistent, but those percentages are different when we slice it just with adults. And it's good to be aware of that. What we do see here, and I kind of wanted to call this out in terms of the opioid use disorder, those trends still continue to be relatively small. They were at 4% in fiscal year 19, and they've dropped to 3% in fiscal year 20. We do see more individuals maybe having secondary and tertiary diagnoses with opiates, but that's not their primary substance use for which they're seeking services. And then I did actually show you that map here on the website just a few minutes ago, but there is the link to the website right here. That's pretty user-friendly, and it will get sent out to be able to access that. And in terms of accessing behavioral health treatment, it's very similar to how any individual may access other health-related services. By contacting a provider, scheduling an appointment, the initial provider will conduct the assessment and determine the level of care or the treatment recommendations. Just like when somebody goes into the doctor for an illness, they're able to do the assessment, do some screening, maybe do some lab works, be able to determine what are those primary concerns to be addressed. The provider can also assist with funding treatment options. Many agencies have the sliding fee scale, so even if they have another payer source or if they have no payer source, then they would be able to be eligible for the indigent funding for individuals who are at 185% of the federal poverty level. And even if somebody is over that 185%, we don't want that to be a barrier. There still is a hardship consideration process for individuals who make more but have unique circumstances as a result of their family life, their work, and even their substance use of what's going on and how that's affected their critical life areas. Agencies are able to assist clients and help them from that admission or from that assessment process all the way to admission if they're looking at having to participate or be involved in more intensive program than what is currently available in their community. And if we go back to that map that showed the levels of care, you can see that there's really only a couple of providers across the state that offer those more intensive levels of care for more complex conditions or diagnoses. And that would be the same thing even for individuals with complex medical concerns. Even folks here in Sioux Falls sometimes have to travel for medical care if they have to go down to Omaha or Mayo Clinic to see a specialist. There's also funding assistance available for medications for individuals who do not have insurance, or if they are not able to cover their copays or if financial means is a barrier for them to be able to take their medications. There's an indigent medication application process as well. And that can be offered to many pharmaceutical companies, and many pharmacies across the state have applied to be part of that process to help their patients out across the state. Oops. Okay, so as I mentioned earlier, there are some areas that don't have a community provider right there in their hometown, but we have been able to we are offering telehealth services, and our providers are offering it and becoming more familiar and are providing more of those services. So due to the pandemic, there have been some flexibilities that have been allowed, such as audio only in terms rather than the two-way video conferencing. You can see here through the eligible services, mental health, through the community mental health services, the eligible services are the psychiatric evaluation, intake screenings and testing, medication management, individual, family, and group therapy. In terms of some of the history behind that is back in January 2011, community mental health centers were able to be reimbursed for medication management. So really over the past several years, the CMHCs have been able to provide services, and throughout the years, they've been able to add on additional services to support their patients and their needs. Back in fiscal year 15, we were able to, as substance use providers, we were able to start reimbursing and providing telehealth services through the substance use disorder treatment providers. And that started with a rural pilot project for just a couple of providers in certain judicial circuits with the 1st, 5th, and 6th Circuit. And those providers were through Volunteers of America and Lutheran Social Services. And throughout the past several years, we've been able to bring on additional treatment evidence-based practices that were able to be reimbursed that way, and then just bringing on all of our providers being able to bill through our traditional substance use disorder services, and that is for assessments, individual counseling, family counseling, group counseling, crisis intervention, and early intervention. So really the whole continuum of outpatient care can be provided through telehealth. And it's important to remember that it's not, some providers and some patients may still prefer to do in-person, and that is excellent. This is another option for providers and patients when maybe transportation is an issue, or childcare is an issue, or the pandemic, or it snowed here in South Dakota yesterday, and so being able to say, like, if weather is bad, they can still continue with their services and still stay engaged with their provider and continue working on their treatment plan to continue identifying recovery and what the skills they are needing to continue to engage in. Want to talk a little bit now about the opioid response grant services that are available. This all started back with the state targeted response grant, and now it has switched over to the state opioid response grant, and actually just starting into the SOR2 funds as well. So it's been kind of a several year project that we've been working on with the Department of Health. And our primary target areas were public awareness, how to kind of identify, how to help people be aware of what opioid misuse or abuse looks like, how to screen for that, how, what to look for, how to help make sure you're safe and your family members are safe, and how to make those referrals. Also looking at prevention, helping provide prevention and education to youth, to colleges, to individuals that are involved in higher education, and then to communities as a whole, helping them to be aware, and then what are prevention strategies that are available in those communities. Connection to resources. So if I have somebody who has a problem with opiate abuse or misuse, how do I get them connected to services rather than, maybe looking the other way or saying, well, geez, I don't know. It sounds like you have a problem, but now what do I do about that problem? And so we've done a lot of work with the resource hotline as well as the 211, and I'll show you those websites here in just a few minutes. And then overdose education and naloxone distribution, as I'm guessing as EMS, many of you probably have naloxone and have been trained in naloxone, but also providing that education to law enforcement, to nurses, to treatment providers, even to family members. This is available. It's kind of like an EpiPen. If you have somebody who's allergic to bees, they have an EpiPen. Well, kind of that same concept, that this is can be just as fatal for many individuals, and having that naloxone available. And then training and education, helping our providers and helping the EMS and the medical staff and, the whole spectrum of care be more knowledgeable and educated, and kind of know what those next steps are to help them be better practitioners and better counselors, and help them to be trained in evidence-based practices. So we've done a lot of education there and awareness and a lot of conferences, and then even providing training for Data Waiver 2000 to be a prescriber for medication-assisted treatment. And that's that next bullet point, and that's been a huge one, is being able to increase access to medication-assisted treatment for individuals who have an opioid use disorder, to help them be able to remain in recovery as a result of some medication that can assist them. And then the last one is the peer recovery support services. I'm going to go into more depth of a few of them. So we'll find it. Okay, so the first one is the State Opioid Response Grant, and this is a really good partnership that we've developed with the Resource Hotline. which is answered by the 211. So the hotline number is the 1-800-920-4343. This has launched with the Opioid Resource Hotline, as well as Opioid Texting Support Program with a searchable online database. And that's through the avoidopioidsd.com website, which I'll show you as well. So individuals who are struggling with opiate misuse or those affected by someone who is they suspect is misusing is encouraged to call the Opioid Care Coordination Program. And so that number can be reached again by the resource hotline, or you can text opioid to 898-211, and then somebody can provide you local resources in your community and those next steps to kind of put those pieces together to offer that support to be able to access services. It's answered 24 hours a day, 365 days a year, and it is free confidential support. They can assist with a variety of concerns or needs, such as the National Take Back Day, which is next week, actually. The treatment options that are available, financial assistance for individuals with opioid use disorder, how to access treatment, how to help a loved one with opioid use or misuse concern, and then also information that may be available for the involuntary commitment process. If you have a loved one, or if you yourself, that you're concerned about that is maybe at imminent risk, and looking at, you've tried to get them to access services and they're unwilling or unable to, looking at an involuntary commitment process to then have a civil process to help get them to that next step of treatment. But that would be if there's imminent danger and they're incapacitated by their use. Care coordination is available to anybody, and they can help connect with behavioral health centers and treatment providers. So it's a great resource just to pass along that number and that support for that individual while they're making those first steps, which can be pretty scary. Going to reach here. The next one is the state opioid, the treatment of opioid use disorder. And so a big part of that is medication-assisted treatment, is the use of FDA-approved medication with counseling and behavioral health therapies to really treat the whole person. MAT is tailored specifically to each individual. It would be no different than somebody who's taking medication for other diseases such as blood pressure, diabetes, depression. And so it just helps them along their path, and it can help relieve withdrawal symptoms while counseling promotes positive behavior change and lifestyles. We have a couple of key partners that we've developed relationships with that are providing medication-assisted treatment in the communities. Project Recovery is located out in the Black Hills in Rapid City, and they provide services to that region as well as Pine Ridge, and they do some telehealth across the state as well. It's an office-based clinic, and you can sign up, and I'll show you how to access their website here in just a few minutes when I get to the Avoid Opioid webpage. Another provider is Center for Family Medicine in Sioux Falls, and they see patients, and they have an opioid or an addiction clinic, but they also are training residents as they are going through their schooling and education to become providers out in the community. So as they're in their residency program, they participate in their addiction training and their clinic, and they're helping them be waivered. So when they go out and are on their own and in the communities, they're comfortable with this, they're aware of what addiction looks like and how to best treat it. So that's kind of a two-pronged approach that we have with Center for Family Medicine. And then Lewis and Clark Behavioral Health Services in Yankton. They're a community mental health center and a substance use treatment provider that provides inpatient and outpatient treatment. And so it was a great resource for them if they're serving their clients right there at inpatient to get them started on MAT if it's clinically appropriate, and then be able to help transition them back out into the community. And through their contract, they've actually developed several partners over the last couple of years and into this year with other community mental health centers. So they see patients across the state and have that availability to have that patient see the counselor in their home community, but that prescribing is done through telehealth with Lewis and Clark. And so those partnerships that they have are with Southern Plains in Winter, South Dakota, Three Rivers up in Lemon, Dakota Counseling in Mitchell, Capital Area Counseling in Pierre, Community Counseling in Huron. They also have a satellite office in Madison, and then the Human Service Agency in Watertown. So you can see that throughout their partnerships, they're really able to help individuals get access to medication-assisted treatment. And so one of this component is not only the access to the medication, but also the access to the prescriber, but the medication as well. So we're able to help provide assistance to cover the cost of the medication, so then they can continue to remain on it, and then make those steps to getting back with, starting potentially working, parenting, working on getting their children back if they're removed from their care at this time. Another component is the intensive case management. We're working with Bethany Christian Services to provide intensive case management to individuals and women who are postpartum who've been impacted by opioid or stimulant use disorder. And so their referrals will come from substance use treatment providers, medication-assisted treatment clinics, child protective services, probation or parole, or other resources. And so it's just another way to be able to assist these moms who are working on establishing recovery. So the next thing is peer recovery support services. And so through a partnership with Face It Together, peer recovery support services are available to provide effective science-based peer coaching to the person living with addiction or their loved ones. It is supported through a model that SAMHSA, so the Substance Abuse and Mental Health Service Administration, using peer support networks, and that is individuals who have been successful in their own recovery process, so they have lived experience. The Face It Together model provides personal experience, coaches, evidence-based approaches, emotional and practical support, and help with behavior change and goal setting. So it's somebody to walk beside the individual living with addiction or that family member to provide support through that process. I'm going to come back over to my website here to show you the Avoid Opioid website and how to access some resources. So this is the Avoid Opioid, avoidopioidsd.com. There's some information in here in terms of what are opioids, how to find help. The searchable database is really resourceful and really useful, as you can type in the information of where you are, and it again is going to bring you to other providers in that area. Want to bring over to Take Action. There is some order-free materials. This has some very helpful things to have. This brochure card is very useful. In fact, you can order some from here, and it's just, you can be able to pass those out to individuals as you come into contact with them, to then they can make that call to the Opioid Care Coordination Hotline to get connected with those resources, or you can leave them with family members if they're at the involved in the services as well. The resource hotline, Avoid Opioid brochure, as well as the business card. So there's a lot of really good tools to be able to have to pass out to just get that information available. If you've ever worked with Tiffany Wolfgang, our director here, she's always said, you don't know who the locksmith is until your keys are locked in the car. And that's kind of the same situation for individuals who are looking for services. It can be really overwhelming and really scary. And so if you can be able to help that first step of here's who to connect with, it can really take a load off of that family or that individual who wants help but not quite sure how to access it. In terms of our opioid use treatment providers, I'm just going to come to this website here because this is talking all about MAT. I'm going to scroll down because here is our MAT providers. And so if we come here, you can click on any one of the websites, and then it's going to bring you to some contact information for them and how to schedule or even maybe get assessed or have a screening for medication-assisted treatment. And so it's a great resource to be able to pass along as well if you have somebody who maybe would benefit from getting evaluated for medication-assisted treatment to make that first step, maybe after an overdose or a situation which you're assisting with. So a lot of really good resources. I'll type these into the chat box here as I pass it over to Andrea to talk a little bit more about the services for mental health and through 605 Strong.
Okay, thank you, Stacy. So we want to make sure that you're aware of the 605 Strong program, which is designed to provide outreach and support to those who are struggling as a result of the COVID-19 pandemic. You may have heard about 605 Strong through social media, print materials, or public service announcements that have aired. The 605 Strong is a crisis counseling program which is federally funded and is based on the presidential disaster declaration that took place on April 5th of this year as a result of the COVID-19 pandemic. Slide 14, please. So the Division of Behavioral Health partnered with the Helpline Center and Lutheran Social Services to provide assistance to those in South Dakota who are struggling due to the effects of COVID-19. The 605 Strong program is important because it promotes also the statewide use of the 211 Helpline Center, which just recently became statewide. So we are using 211 for COVID-19 related resources and support. Since the onset of COVID-19 cases in South Dakota, the Helpline Center had already experienced heightened call volume at the rate of more than double the call volume over the same time the previous year. Nearly 20,000 calls were received to the 211 helpline in April of this year, and another 9,000 calls were received in May. More than half of those increased calls were specifically related to COVID-19, which made 211 a perfect partnership for this particular grant. The call volume has continued since June 29th of this year. We've had an additional 6,816 helpline contacts, and which have led to 248 separate follow-up telephone contacts that our 605 Strong team at the helpline has made for those individuals who were needing additional support. Through outreach, there have been 577 individual or family crisis counseling contacts, which have impacted a total of 927 people. The 605 Strong teams have completed nearly 5,000 mailings of material, and they've also handed out an additional 1,900 materials at key locations within the community. Slide 15, please. So this slide shows you some of the groups that we are targeting our outreach to. This targeted outreach has been provided by Lutheran Social Services, initially to support refugees and their families working at affected employers, including the meatpacking plants in Sioux Falls, Aberdeen, and Huron. LSS is continuing its current efforts as well as expanding their outreach to additional persons who are struggling. So this includes healthcare workers, the business community, children and families, nursing facilities, as well as tribal members. The 605 Strong teams from 211 and Lutheran Social Services have also collaborated to provide town hall style webinars on various topics created to meet the needs of various groups, including teachers and school administrators, as well as parents. And as this pandemic evolves, these webinars will continue to be provided and be tailored to meet the needs of the populations that they are serving. Slide 16, please. So wanting to talk a little bit about self-care during a disaster, don't underestimate the impact that the added stress of this pandemic may be having on you, and it's important to implement healthy coping skills. So those in a helping field, such as all of you as EMS providers, may experience the feeling of being superhuman, as though this pandemic won't affect you. Which is normal when you're putting all of your energy into helping others. It's easy to not realize how things are actually having an impact on you. We've seen that many individuals have been turning to unhealthy coping skills as a result of the pandemic, such as increased alcohol consumption. When we had done a similar presentation a few months back, I had found some data showing that the week ending in March 21st, that US alcohol sales rose at 55% from the same time the previous year, and online sales of alcohol were up by 243%, which I think those are pretty shocking numbers. Slide 17, please. So again, just talking about really understanding the impact that the stress from the pandemic may be having on you and learning to implement some healthy coping skills. So this is a lot of what our 605 Strong teams are doing over the course of their outreach, when they're doing the town hall style webinars, when they're meeting face-to-face with individuals. So taking care of your body is important. Taking deep breaths during your workday, stretching, taking walks, taking bike rides, or maybe a nice walk in the snow as we head into these winter months. Doing other things that you can do in your home. If you're not comfortable going out to work out, you can search up yoga or Pilates on YouTube and take a class from home. Being creative when it's raining outside, play video golf, walk up and down the stairs between holes as though you're walking on a golf course. That was actually something that we had our boys doing when they were cooped up in the house during the previous school year, doing the distance learning. We tried to keep them as active and busy as possible. So kind of taking some of those same concepts. It's important to eat healthy, well-balanced meals. Planning your meals in advance can help, making sure that you're getting plenty of sleep. Again, avoiding alcohol and drugs, and making sure that you have some fun. So there's certainly nothing wrong with a little harmless distraction after the workday has ended. So doing things like playing a board game, watching a funny movie, reading a good book, or even just taking up a new hobby. Talking about it is also very important. So while we're doing the social distancing, or if you're needing to do the self-isolation because of COVID-19, understanding that that can leave you feeling lonely and depressed. So if you're feeling that way, make sure that you talk about it. Call a friend, do a video chat with family. Important to think about physical distancing rather than social distancing. So just because you can't be with people doesn't mean that you can't virtually be with people. Setting up online chats with a group of family and friends is a great way to keep yourself connected with your loved ones. And then make sure that you take time to unplug. So even though it's important that we keep up to date on current information, too much of the news, which is so oftentimes bad news, can just lead to increased anxiety. So make sure that you take breaks from reading or watching news about the pandemic, or this time of year, politics is certainly another thing that can cause stressors for people. And slide 18, please. Okay, so the 605 Strong grant will continue on through May 31st of this year. The division additionally has funds available via another emergency COVID-19 grant, which supports mental health and substance use services. This emergency grant has already been used to provide many of our state-funded agencies with the necessary equipment that is needed to provide telehealth services. We will also continue to use this funding as needed to backfill those agencies when they've expended other funds, because we want to make sure that they can continue providing those necessary services to the people of South Dakota. And slide 19. So we want to thank you for joining us today. We will be available after this presentation to answer any questions, but we also wanted to provide you with our contact information. So if you have any additional questions down the line or are looking for information, you can see how to contact us. Feel free to make a contact by email, give us a call, or check out our website. And thank you very much.